I am a healthcare worker. I'm a primary care doctor here in the Bay Area. And I just want to make clear that I am not working on the front lines. I am stuck at home actually because I'm immunocompromised. So I have been working from home over the last few weeks doing chart reviews for patients who have symptoms of the coronavirus, determining who gets tested and who doesn't in our area. Many of my close friends and colleagues are on the front lines of this fight, both in clinics and in hospitals. And I'm going to talk about the response of the government to this pandemic and the effect it has had on healthcare workers and patients. It's been a patchwork of inadequacy that has been detrimental to the health of our communities. It has been an indisputable failure, and I described it recently in an article as nothing short of criminal. And I believe it, and I'm going to share it with you why I think that. So we knew this virus was coming. The United States had a 2-month lead time. South Korea and the US, their first cases were January 20th. South Korea immediately implemented mass testing and was able to get their outbreak under control. South Korea to date has 177 deaths by COVID-19. The United States, on the other hand, waited for 2 months and now has the most cases in the world with 8,098 deaths as of today. The entire response to this crisis has been based on delay, disorganization, and a rationing due to scarcity. So I'm going to give you some examples of the scarcity in testing. So we didn't know when we would get tests. Then finally we got tests, and we got them in drips and drabs. And so when you have a small amount of tests, you have to figure out how you're going to give the tests and who you're going to exclude and who you're going to include. So we had all sorts of protocols that we had to put into place. So we would put our patients through a protocol in order for them to qualify for a test. So if are you over 60? No, this patient is only 59, so they missed the cutoff. So no test for you. You have allergies and a cough, but you don't have a history of asthma. So no test for you. Sore throat, but no fever. Nope, you don't get a test. And it's the worst job. You feel like crap when you're doing it because you know people who have symptoms during this time, if they want a test, they should get a test. And these patients are calling us and letting us know about their symptoms because they want testing. And we didn't have enough tests. And we still don't have enough tests. So you don't know when you're going to get tests. You're being told by, your admin that we have a week's worth of tests, so make sure you guys aren't being too liberal. So then we have these limited tests. We're kind of making calls on who gets them and who doesn't. Test turnaround to get results is somewhere between 5 and 10 days. In South Korea, they could test and have a result back in a few hours, so you would know if you're COVID-19 positive or not. Here, we're waiting a week, maybe more. I spoke to a patient last week. He was in his late 70s. He had a cough, he had shortness of breath, and I'm listening to him over the phone because I can't quite tell, is he wheezing, is he not wheezing? I'm trying to determine whether I need to send him to the ER. And he realized he was getting short of breath when he lives alone, and he went grocery shopping on his own, and he felt short of breath, so he called. And he's deathly afraid to go to the ER because he's heard that, hospitals have the virus all over them, so he doesn't want to go. And he asked me, he's like, well, I want to wait right now. I live only 1.5 miles from the hospital. Is it okay if I wait, and if I get worse, I'll walk to the hospital? And, I had to say, no, I don't want you walking to the ER. If he does have the virus, he's going to tax his lungs even more. His lungs, if he is positive, it's struggling to get oxygen in the first place. He could go into respiratory distress on the way to the ER. But, it just struck me that look at this system. First of all, there's no reason why an older person who lives alone should have to go out and expose himself and get groceries potentially to the virus at the grocery store. And then on top of it, he's, potentially walking to the ER. And we should have a system in place where vulnerable patients like him can easily get someone to visit and get tested. And we don't have a system like that. We didn't have enough tests, so we don't know who's infected and who's not unless they're sick. And then, when they are sick, depending on if they hit the protocol, it's like winning the golden ticket when you get the test. And then in the meantime, the rhetoric that the politicians they're calling this a silent spread and a silent killer. And the only reason it's silent is because we haven't been testing. So in many of our clinics, just recently in the last week, towards the end of last week, we got told that, we're partnering with someone and now we're going to have access to thousands more tests. So, we can loosen our criteria now. So I was screening patients the other day and I honestly felt like Oprah. I was just like, you get a test, everybody get a test. It was this heady feeling because I spent the last 3 weeks rationing these tests, not based on science, but based on scarcity. So many of our decisions right now aren't based on what is good science. It's based on the fact that we are lacking the things we need. So when you start out by rationing testing, you pretty much guarantee that the next step is overrun hospitals where you're rationing care, choosing who to save and who to let die. And we've seen that in Italy and France and Spain, and that's starting to happen in New York as well. So we've had a scarcity of tests, but it's also turned into scarcity of medical equipment as well. And I'm sure a lot of you have heard of PPE, which stands for personal protective equipment. There are hashtags all over Twitter, hashtag get me PPE, we need PPE. So why is protective equipment so important? And luckily Garrett touched on this with respect to, our rights as workers, aerosol, transmissible disease, employers need to guarantee our health and safety. And I'm glad he kind of set up that rubric for us. So why is the PPE important? It's because of how COVID-19 spreads. And liquid droplets from sneezes and coughs and even just exhaling can travel. It can travel as far as 26 feet and linger in the air for minutes, if not hours. Particles can linger in air circulation systems, on ventilation systems, in the fans. So if you don't have adequate protective equipment like N95 masks, like face shields, gowns, without this stuff, hospitals have become the place you're most likely to become infected. So in Spain, the numbers are around 14% of confirmed cases in Spain are healthcare workers. In Italy, some of the numbers are around 20% of confirmed cases are healthcare workers. So in the context of knowing these numbers, here in the United States, all we still have is scarcity. So the CDC, the Center for Disease Control, they've published guidelines on extended use of this PPE. So we're supposed to reuse and extend the life of these single-use personal protective equipment like the N95 masks. Workers are getting, one brown paper bag, like the sacks we used to use for lunch when we were kids. And in this brown paper bag, they're given their one N95 mask. And some places it's supposed to last you your 12-hour shift. Some places are saying you need to make this last the whole week. And the CDC, who's supposed to set the national guidelines of response, they're now saying, nah, it's okay if you don't have proper equipment. About a week ago, they put on the CDC website, they actually had the audacity to talk about, in the context of not having enough, you could try bandanas or scarves. Bandanas and scarves aren't based on science. That's based on scarcity. And healthcare workers are terrified, as they should be. They've been walking out. We had Kaiser Oakland nurses. They walked out about a week ago, and their chant was, if we get sick, then you get sick. If we get sick, then you get sick. And they were donning bandanas and scarves in response to what the CDC has on its website now. And the reality is, if our healthcare workers are infected, and we know that there is asymptomatic transmission of this virus, meaning you don't need to have symptoms. You might not even feel anything. 1 in 4 people don't even feel anything necessarily. And you can be spreading it to the people you're close to and you're around. And so nurses, healthcare workers, anybody who works in a hospital or a clinic, they have every right to be scared and every right to walk out and every right to ask for protection. I saw a photo of a healthcare worker showing the PPE that she was given for the day. And it was a Yankee rain poncho that they give out to Yankee fans when they go to baseball games. It was a tiny, flimsy rain poncho that was her PPE for the day. We've seen photos of healthcare workers converting scuba gear and snorkel gear so they can protect their face from these aerosols that are transmitting. If you see pictures of healthcare workers in China and Italy, they look like astronauts. They are covered head to toe. There's no exposed parts. They look like they're in sci-fi films or something. And you'll contrast these with the US healthcare workers who are wearing flimsy single-use masks, thin yellow, disposable gowns. And it's gone so far as recently there were pictures of nurses in trash bags because that's all they had to protect themselves from a potentially deadly virus. So I want you to picture this scenario. You're going to work to save people's lives. You're going into the most infected place that you can be. And you are not given adequate protection. So what do? So for a lot of people, they're going to find another way to protect themselves and find another way to get what they should have been given in the first place. And so what's been interesting is the response to this, to people trying to get their own PPE. So I'm going to give you some examples of what's been going on across the country. There was an ER doc, Dr. Lin in Bellingham, Washington. He pleaded for more PPE for his staff. He was worried about his staff members. I mean, we have people going out to Home Depot and buying PPE for their staff. So this guy's worried about his staff, worried about them getting exposure. He had worked at this hospital for 17 years. He was fired. He was fired for speaking up and speaking out. There's a Dr. Ringwelski, an ER doc at Cornell. She brought her own PPE to wear at her hospital. She was sent home. There's a nurse in Chicago, Lori Mazurkowitz. Her and her colleagues, they were given flimsy face masks. She brought her own N95 to work. She brought an N95 mask. She was fired by Northwestern Hospital. And the reality is we are seeing more and more healthcare workers who become patients. We have an ER doctor the other day in New York reported that when he reported for work in the morning, his COVID patients were healthcare workers. There was a nurse, an internist, a pulmonologist, a gastroenterologist. These are his patients, and they were all medical staff. Healthcare workers across America are making, they're writing wills, they're making their wills, they're putting everything in order, they're writing letters to their children just in case. They're isolating from their own families. Some of them are living in garages, some of them are renting hotel rooms because they don't want to come back and bring this virus home because they're not protected themselves and they don't want to compromise their loved ones. And we're sending them like lambs to the COVID slaughter. That's the reality of it. There was a report the other day of a doctor who died in his husband's arms, and his husband is currently COVID-19 positive. So this is what's going on all across the country, and we are not protecting our frontline workers. I have a friend who works at a hospital, and one of the first meetings they had, this is, the virus is coming. This is the meeting that they have, a huge Zoom meeting with hundreds of people. Her and her colleagues got told that if they were exposed to COVID-19 at work, where if they found out that one of their patients was positive or they started coming down with symptoms, they would have to get a test from their own doctor. The hospital wasn't going to use their limited tests on their own staff. So can you believe that? First of all, you're not going to give me adequate protection to do my job. And then if I get infected on the job, you're not going to test me. I have to call up my own doctor and get tested. So doctors, nurses, and other healthcare workers, they're being lauded as heroes. But the reality is nobody signed up to be a martyr. When they signed up to work in clinics, work in hospitals, nobody signed up to be a martyr, and nobody should be forced to be a martyr. I know Garrett talked about different workers who are being compromised in their workplace, and he brought up Detroit. There are people all over concerned about their lives, grocery store workers, bus drivers, a lot of warehouse workers. Some have been getting sick, some have died. Some have had to fight to get tested, and their job puts them in harm's way. I have the example of a bus driver in Detroit. Bus drivers in Detroit were so upset at their lack of protection, they walked out on March 17th. And only after that did they start getting gloves, and they got to wear masks if they could get them. There was a bus driver, Jason Hargrove, and he posted on social media, and he spoke to the people of Detroit, trying to get them to take the virus seriously. 4 days after he posted a video, he died himself of the virus. I was on the phone last week with a patient. She is a local grocery store worker, and she was on shift at her store, and she was coughing, and she was moderately short of breath, and I was encouraging her to go to the ER, and we had a back and forth, and she said her manager wasn't letting her leave her job to go to the ER. She was pretty much getting forced to be a cashier and check people out, even though she was actively symptomatic. And it's any level of worker. Some of you guys might have heard about the Navy ship, the USS Theodore Roosevelt, and the aircraft carrier Captain Crozier. Out of a crew of 4,000, they tested about half of them. 100 of his crew were testing positive for the coronavirus, and he pleaded for help for his stricken crew. And what happened to Captain Crozier? He was forcibly removed from command and escorted off of the ship. So it's clear in all of these cases that we are on our own. That much has definitely been made clear. And for healthcare workers, it's been clear for a long time that the priorities of the people running the hospital and running the clinics are not the priorities of the workers in the hospitals, and they are certainly not priorities that help our patients in the hospitals. We know what we need to work in a safe environment, and the only reason we are not safe is because someone else is pulling the purse strings, prioritizing profits over people. And this is a crisis, and this is a horrible crisis, and it's very hard to stay up in a crisis like this. But I think the only silver lining in this is that this system is laid bare and exposed for what it is. And we know, you and I and the people we know we could run it better. We could run it in a way where people come first and people's lives matter. So whether it's my coworker who's a healthcare worker, he right now in his living room, he has thousands of face shields and masks that he found a distributor in China, and he checked the quality and he ordered them because he knew that he might not be able to depend on his hospital to have enough supplies for him and his colleagues, and he paid for all of that out of pocket. Whether it's him or my other friend in healthcare who was so worried about the lack of response with respect to sheltering in place and social distancing that she got a hold of the mayor of her city, and she implored him to close the port to the cruise ships that kept coming, even though we knew that they shouldn't be disembarking, they shouldn't be running, and that it was compromising the health of her community. So she spoke out and she spoke up. Or whether it's nurses supporting each other when one brings homemade PPE to the hospital and standing together against hospital admin, or whether it's environmental services, the unsung heroes who decontaminate the hospital, who are actually getting seen and recognized for the important work they do day in and day out. There are reasons for hope, and there are fires getting lit every day in people to demand to see a different world. Thank you.